Hi, good morning. This is Dr. Junres, your physical therapist. I am based here sa New York. Maganda ang topic natin. Ang topic natin ay tungkol sa frozen shoulder. Ano ba ang frozen shoulder? Ang frozen shoulder is also known as adhesive capsulitis. So, ibig sabihin ng adhesive capsulitis, madami tayong adhesions, lalo na dito sa below the shoulder or inside the shoulder joint. Nagkaroon tayo ng adhesions or fibrosis. Ang dahilan ng pagkakaroon ng frozen shoulder, hindi pa rin natin maintindihan. We have two types of frozen shoulder. One is a primary frozen shoulder and the other one is secondary frozen shoulder. Pagka sinabing primary frozen shoulder, bigla na lang siya nangyari. Idiopathic siya. Bigla na lang tayo nagkaroon ng pain, usually severe pain sa gabi, severe limitation of motion sa internal, external rotation, every movements, flexion, and abduction, nagkaroon tayo ng limitation bigla. Yung secondary frozen shoulder naman, yan ay secondary to an injury. Pwedeng nagkaroon tayo ng rotator cuff injury, or nagkaroon tayo ng tendinitis or bursitis, hindi natin ginalaw, nagkaroon tayo ng secondary frozen shoulder. Or mga pasyenteng nagkaroon ng stroke, hindi nila ginagalaw, so nagkaroon sila ng frozen shoulder. Ngayon, ipapakita ko sa inyo ang tatlong effective na exercise na nababawasan o matanggal ang pain ng frozen shoulder. Itong tatlong exercises na ito. Okay? Umpisa na tayo. So bago tayo mag-umpisa ng mga exercises natin, please hit the subscribe button. Ito pong subscribe button na ito para ma-up-to-date kayo sa ating mga bagong videos. Exercise number 1, pulley system. So if you don't have any pulleys at home, you can use the jumping rope or any kind of rope. Recreate this. So hihilahin lang yung shoulder. For example, ang frozen shoulder ko dito sa left. So upo muna tayo. So, yung left shoulder ko limited ng 80 degrees. Hanggang 80 degrees lang ang kaya ko. So, what I would do is just pull it gently. Hold it for 10 to 15 seconds, 10 repetitions. So, if I'm limited dito, hold it for 10-15 seconds and bring it down. So, masakit dito, pull it a little bit more. Yeah. And pull, gentle, slow stretch. Okay? I'm going to show you one more time. And pull it as far as you can go. Ang maganda dito, pag nag-increase yung range of motion mo, mag-alleviate din ng pain. So hanggang ma-reach mo yung 180 degrees range of motion. Okay? Now, meron din yung shoulder abduction. A shoulder abduction, moving your shoulder this way. Ang left shoulder ko, lalo na shoulder abduction, limited. Sa mga frozen shoulder, limited siya hanggang dito. So if I can pull it, pulling this way, tataas natin yan. Unti-unti lang, masakit ito. Isa sa pinakamasakit na range of motion. Hold it for 10 to 15 seconds. 10 repetitions. Again, 10-15 seconds. 10 repetitions. Until makuha mo hanggang mag-improve yung range of motion up to all the way up, just like that. Okay. That's one, shoulder abduction, and then pull it all the way right here. Now I'm going to show you paano yung internal rotation. Ito isa sa pinakamasakit na movements. Okay, so we're gonna move this chair. Internal rotation, lalagay lang dito. Alright? Rotation. Kung hanggang dito lang kaya, okay lang yan. And stretch. 10 to 15 seconds. Stretch this for 10 to 15 seconds. Hanggang ma-reach natin ang normal range of motion. Napakasakit nito. So, start here. Hold it for... Okay, so we're gonna do a pendulum exercise. Gagamit tayo ng 2 pounds weights or a can of soup. So pag gagawin ng pendulum exercise, it's actually help alleviate pain, increase lubrication in the joint, break down the adhesions or fibrosis. Kaya natin ginagawa ito. Habang nag-improve ang ating range of motion, actually nakakatulong na mabawasan ang pain. So I'm moving my trunk to create that movements. Overall, this is a 2-minute exercise. So you can do rotational movements using your body. You're doing that. Rotational, so increase that movements. And then you can also do shoulder in adduction and shoulder abduction. So you're going to do abduction and then adduction. So keep swinging that arm, going this way. Combination of trunk movements, okay, and then shoulder flexion, and then extension. Make sure you're not gonna let go of the weight, okay. So again, 30 seconds. Napakasarap nito. It actually helped my patients alleviate the pain after doing this pendulum exercise. Kasi again, nahihila ang ating joints using the distraction force. Okay, one of my favorite exercise for frozen shoulder, itong pendulum exercise. With a broomstick or a cane, any kind of stick, as long as it's long, just like this. And I created this exercise ako kasi pagka may frozen shoulder, lalo na pagka bago pa lang, you have to just keep moving the shoulder kasi it's gonna get tight. So, ginawa ko tong Reyes technique using this stick just by doing movements of the cane or movement of the stick going forward and then back, shoulder extension, papakita ko sa inyo, shoulder flexion, and then combination of rowing. Dito pa lang masakit na siya, so I can just do oscillation movement. Igalaw-galaw niyo lang ang shoulder nyo going this way. Nakakatulong mag-alleviate ng pain. And then forward. Kung masakit siya dito, keep doing it. Small movements. You can do oscillation movement, up and down. Small movements lang. Small movements for shoulder, for frozen shoulder. Nakakatulong ito ma-alleviate ng pain. Again, maybe 3 times. Oscillation. And then back, oscillation. Forward, oscillation. And then back. Oscillation movements. Mga 3 times backwards. Now you can also do rotational movements. Gamit tong stick na to. Masakit, kung masakit siya going, as you can see, my thumb is up. Okay? I-move mo lang yung stick na sideways. Ayan o. Ayan. Eto, ginawa ko to sa mga pasyente ko dito sa Reyes PT. I created this motion, this type of exercise na nakatulong sa aking mga pasyente, ang frozen shoulder. So again, this is a 1 to 2 minutes exercise. So just, kung hanggang dito lang ang kaya, okay lang. Right? And then you can add some range of motion. You can put your hand right here. So, a bigger motion. Pagka nag-improve na ang ating shoulder range of motion. Yan. So again, back and forth. Just like that for 30 seconds. Just like that. Okay. Stretching na ito isa sa pinakamasakit sa frozen shoulder. So you can start slow lang tayo gamit itong stick na ito. Hawakan lang natin ang dulo and then thumbs up just like this and then hold it for 10 to 15 seconds. Do this for 10 repetitions. Last one. Make sure nakadikit sa katawan natin ang elbow. And then stretch all the way as far as you can go and hold it for 10 to 15 seconds. And kung itong frozen shoulder mo, itong left side, itong side na to, just stretch it as far as you can go. Yan ang mga exercises para sa mga pasyenteng may frozen shoulder. And please make sure, hit the like button, share our videos, and para sa mga bago dyan, please subscribe. Subscribe po dito, subscribe dyan. And thank you and God bless. Take care.